So my name's Kerry Daniels. I'm the Graduate Program Coordinator here at Austin Health. So welcome and thank you for coming out this afternoon to come and find out about our programs here at Austin Health. I've also got some of my team members with me here. Sonia Ganji is one of our experienced clinical support nurses in the graduate team, and Sonia will be doing some of the presentation. And Antoinette is at the door, and she's also one of our clinical support nurses here. Now we've got a concurrent session happening at 4 o'clock, so we plan to finish up by about 3:45. If you have questions that we haven't had time to answer, please make your way back around to the level 4 education area, because the rooms around there will still be set up 4.4 and 4.5, and some of our other team members will be there if you wanted to go around and have a chat to them. Okay, so whilst I've welcomed you, I'd also like to acknowledge the traditional owners of the land on which we meet, the Wurundjeri people of the Kulin Nation, and pay respects to their elders past and present. All right, so we'll make a start. So this is just an introduction about the vast hospital that we have here at Austin, and I'm just going to flick through some of these slides. I'm sure if you've been on the website you may have already had a look at some of this information, and some of you may be aware of our campuses, etc. But nice for those of you that have never been here or don't know a lot about Austin Health. So we have 3 campus sites. Obviously, where we are now is what we call the Austin Tower, the main campus here, the Austin Hospital, and we also have our Repatriation Hospital around the corner, not far away in Heidelberg, and also the Royal Talbot Rehabilitation Centre in Kew. And we also have a large mental health precinct co-located here as well, and the Mental Health Graduate Program Coordinator will be giving her session after ours today. So again, a lot of information on this slide. You can have a little bit of a read of it, but obviously a large world-renowned health service here at Austin Health, internationally recognised in a number of clinical teaching, training, research fields, and also lots of affiliations with universities. So you can see there the snapshot from the previous 2014-2015 year. 100,000 inpatient admissions, 185,000 outpatient attendances, and I'm sure it's gone up in the last year as well. So again, just to give you a bit of an understanding of the type of organisation that you would be coming into as a graduate nurse, if that's what you choose to do. Lots of specialist services here at Austin Health. Again, some of them very specific to Austin and only provided by this organisation, and one of those being the Victorian Spinal Cord Service. And I'm sure a lot of you have seen you know, people on the news rehabilitating out at Royal Talbot. People actually get flown from all over Australia to come to our facilities here for spinal care. Victorian Respiratory Support Service, liver transplant unit, acquired brain injury unit, again, highly specialised, if not would be the most specialised acquired brain injury unit, certainly in Victoria, but if not in Australia as well. Child mental health inpatient unit, toxicology service, and poisons as well. So that's just a listing a few of them there. Just a couple of photos here of our Repatriation Hospital. And for those of you that may be unaware, the Heidelberg Repatriation Hospital used to be a standalone hospital prior to amalgamating with Austin, and obviously a hospital which was dedicated to our war service veterans and remains so today. So there's a very strong focus there in supporting our veteran community, as well as all of the generic ward areas that we offer at Repatriation Hospital as well. And they're the beautiful gardens and grounds there, which have actually been put together by a horticulturalist at Royal Talbot who is a nurse. And they're just, yeah, beautiful gardens for those patients that are able to enjoy those surroundings while they're undergoing often extensive rehabilitation over months or sometimes years. And of course, it's not hard to miss the ONJ Cancer and Wellness Centre at the front of the hospital which has now been, 2017, open for nearly 4 years now. So for those of you that have an interest in oncology nursing, magnificent facility, and I'm sure any of you that have had the opportunity of going in there will attest to that. And we have a state-of-the-art simulation centre as well for all of our nursing, medical, allied health staff, which really assists us with our training and development. And we have a coordinator of the Sim Centre who's always available to help us out in getting together different types of programs for all levels of nurses. So I think a great place to start your nursing career here at Austin. We have a very specific vision here for our Austin nurses, and basically, aside from the values that we have, and all organisations that you will research or go to, obviously, will have their own sets of values. We've added a few to our generic values, and I guess the most important one being that our vision here for our Austin nurses is that we strive every day to create the best patient experience. And that's what we're really aiming for. That's what we're looking for when we recruit graduate nurses. So why choose Austin over the, lots of options that you will have when you're applying for graduate years? We'll go over some of these points in a little bit more detail. A comprehensive, well-supported early graduate program, as well as an enrolled nurse transition to practice program. Nursing experience, as I've mentioned earlier, at a world-class health facility. And we do have a culture of respect, support and excellence. We're very well known as a very friendly hospital. Don't know if any of you have heard that, but a lot of people and a lot of graduates will tell you, I chose Austin because it's a very friendly, positive working environment. And I think that's a real plus, as well as all the other challenging things that Austin would have to offer you. We've got a dedicated graduate clinical support nurse team, as I mentioned, so Sonia and Antoinette are part of our team. We have about 6 full-time, very experienced registered nurses, most of them who have come through graduate program at Austin. And I think I tallied up all of our years of experience for another talk I was giving, and I think it was well over 150 years, but myself and one of my other colleagues make up a lot of that. But no, seriously, our clinical support nurses, they're all 10 years plus. They're really exceptional clinicians. But not only that, they're also highly skilled educators, and above and beyond that, in grad program, they are counsellors, mums, what else, Sonia? Social workers, yeah. They're basically your go-to person for any issues that you may have throughout the year, and they are here for the full 12 months to support graduates. They don't have any other role description other than working in the graduate program. So they're supernumerary. We're all supernumerary, so we work Monday to Friday, and all of the team have different areas that they cover, but we all work collaboratively as a team. So if one person's not here, then that the other team members will endeavour to cover the graduates in their area. So it's a really cohesive team. I mean, obviously I'm biased as the coordinator, but I think, when you do your research, I think you would be hard pressed to find a type of support team that we offer here at Austin Health. I really believe that's the hallmark of our program. And I know from talking to graduates, both here and at other organisations, again, what I hear is the support that graduates are given at the Austin over and above all of the other education team that we also have in place that are there for you as well. Lots of clinical areas that we offer you in the grad program. I just would point out, if Sonia's going to take over now, but we have 3 streams. Okay, so the enrolled nurse transition to practice program obviously is separate and doesn't involve computer match. Is there any enrolled nurses in the room? Yep. Okay, so your application process and everything that I'm saying today about the early graduate program is exactly the same, except you don't have to apply through computer match. So I'll touch on that. And we're also offering a combined mental health general stream as well for 2018. Is anybody here interested in that stream? Yep, so there's quite a few. So again, everything that I'm talking, for those of you interested in combined, about the general stream will still apply to you, except half of your year will be in mental health and half will be in the acute stream. So we'll give you a little bit of information about that as well. Thanks, Sonia.
All right, welcome everyone. As Kerry mentioned, my name's Sonia. I'm one of the clinical support nurses on a team of about 8 of us that cover the 3 sites that Kerry mentioned earlier in the presentation. So I'm just going to talk a little bit about the support and opportunity that's available to all of you throughout the program. Hopefully I can sort out IT situation. So first of all, we're very invested in closing the gaps. So for those of you who identify as Aboriginal or Torres Strait Islander, there's just a little bit of a different process with computer match as to the guidelines for applying for the graduate program. So if you are in that category, we'd really encourage you to speak to Kerry Daniels just to talk about the guidelines around applying for the graduate program. Not that it's entirely different, but in terms of the funding with that aspect of the program, it does vary a little bit to the mainstream. So yeah, just definitely give Kerry Daniels a call and she'll be able to talk you through that process. So what do we offer? In our general stream for the early graduate program, we have between 100 and 110 positions, so that varies a little bit year to year. For our mental health stream, there'll be 8 positions available, and for our combined general and mental health, there'll be 4 positions available. Each of these programs, as Kerry alluded to, has separate computer match listing and separate application processes, so make sure that you do apply for the correct stream that you would like. For our EN Transition to Practice program, we have about 10 positions available, and we had around about the same this year, and it's been quite a successful program. Our start dates, so we normally have a January and February intake. For those who will be doing the mental health graduate program and the combined general and mental health, that will start in February, so you won't get that choice of start dates. But for our early graduate program and enrolled nurse transition to practice program, it'll be a Jan or Feb intake. There is a possibility that there may be a May intake as well next year, but we're just getting clarification on that. So we don't have definite details of that yet, but there could be a May intake for next year, just so you're aware. In terms of our contract for employment, so all graduates are offered 0.8 contract, so that's 8 days a fortnight, and it's a 54-week contract. Okay, so a little bit about the extensive clinical support that we offer. Obviously, myself and Antoinette would be a little bit biased, but I myself have been at Austin for 11 years now, and from day dot when I did my graduate program here, that's the one selling point that really kind of got me through the graduate program, and I always really aspired to be like the clinical support nurses that I had 11 years ago. So we do really pride ourselves on the support that we provide graduates, and a lot of them do go on to, you know, some of them have actually joined the team years after their graduate program. So it really is testament to how they felt in their grad program. So in terms of what we offer, like Kerry said, we've got a dedicated graduate clinical support nurse team. So we're basically in a supernumerary capacity and we're there solely to offer you support on the floor. Obviously we do lots of other things such as, you know, mentoring and debriefing and, you know, being a social worker and a mum and all that kind of stuff. But we do really want you to have the best experience in the grad program, and that comes with feeling really well supported. On top of that, obviously we've got the coordinator, we have ward-based preceptors, we have clinical nurse specialists on the ward, ANUMs, NUMs, we even have ward-based clinical support nurses in most areas, as well as clinical nurse educators and education coordinators. So I could go on and on about you know, how big, how wide the team is, but it's not just us that are there to support you. You're actually really well supported by a wider education team as well. And we work collaboratively, so, you know, obviously we have quite a few grads that we see, but if we can't get to you, we do resource and network within the education team to make sure that you're getting the support that you need on the ground. Okay. When you start with us, we offer a really comprehensive 5-day orientation program. That's made up of lots and lots of sessions. We do sort of more didactic sessions where it's a similar environment to this, where we'll go through lots of HR stuff, and then we run practical sessions, so skills workshops. We get you all scrubbed up on those skills that you may not have done for a while. You know, everyone panics about IVs and, you know, all that kind of stuff. So we do put you through quite a few workshops to make sure that you're feeling confident before you head out to the wards. So that is a very comprehensive orientation program. We offer 2 6-month rotations. We do consider your preferences, but the whole purpose of the grad program is to give you a really well-rounded grad year. So we want you to really spend it consolidating, okay? You're not going to get 2 really acute surgical rotations because that just wouldn't benefit you. We try to give you something polar opposite. So you will be guaranteed an acute or high acuity specialty area for one of your rotations, and then you'll work somewhere like continuing care, subacute, rehab. So something that's completely different. And we don't do that. We don't want to be, you know, seeing like we're torturing people, but you really want to have a really well-rounded grad year. And there's skills that you pick up in different areas that, you know, you might be on a surgical ward and you won't get that kind of consolidating from a rehab experience or a subacute experience. So we do try and accommodate at least one of your preferences if you are successful, but you do need to be open to rotating to any of the specialty areas and all of the 3 sites as well. Obviously you can't get to the 3 sites because you'll be doing 2 rotations, but you get my point. We do offer supernumerary days for each rotation, so that does vary depending on where you're going and what the ward is able to offer you at that time, but usually you get about 4 supernumerary days in your first rotation. And obviously you'll be buddied up with somebody with the expertise to help you sort of settle into the ward and feel comfortable. We also offer a minimum of 3 paid study days throughout the year, and grads love these. So we do a general sort of what we call a mandatory study day where all the grads get together as a group. We do a pain study day, so we go through pain management, and we do an aggression management. So sometimes over and above that you will get a study day in your area of specialty. So that might be an oncology study day or a renal study day or a surgical. So it depends on which ward area you're rotating to. And we are a structured program, so we have you know, goals that we want to help you achieve, and we also have specific grad learning opportunities, you know, along the year. So in terms of your 2 clinical rotations, we offer a range of acute medical and surgical specialty wards, continuing care, which is more so your Repatriation Hospital and Royal Talbot Rehab Centre. Rehab, spinal, acquired brain injury, you can kind of see it all there, ED, paediatrics. We've got the mental health combined. All of our patient ratios are in accordance with our nurses' EBA. We have health assistants in nursing. Are you heard of health assistants? Yes, some no's. So we have health assistants on most of the ward areas now, and they're in addition to the nursing ratios. So they assist with a lot of the activities of daily living with the patients. You'll get a maximum of 4 weeks of night duty per rotation. If you're lucky enough, you'll get none, depending on where you're rotating. And you'll thank goodness for the permanent night staff. But at a maximum, you'll get 4 weeks. And like I said, with the early graduate program, enrolled nurse transition to practice and combined mental health grad nurse year, you will get an acute rotation guaranteed in each of those. So I'll let you have a read of all of the clinical specialties that we offer at Austin. As you can see, they're quite vast. The only places that you basically wouldn't rotate would be ICU and theatre. Everything else is on offer. So there's quite a lot of opportunity there. With the mental health combined stream, so the 2 areas that you would potentially rotate to would be adolescent and child psych unit and the secure extended care unit. So you'll get one or the other, and your next rotation will be an acute rotation, so either medical or surgical. So our program strives to provide consolidation and transition to independent practice for grads and enrolled nurses with a best practice positive learning environment. We obviously want to develop nurses who can deliver excellence in nursing care and really deliver our vision for the hospital, which is to create the best patient experience, because at the end of the day, that's why we're all here. So we really want you to be embracing the nursing vision and values of the hospital. We like to think that we foster organisational and workforce integration. So it's not just about providing the clinical care, but it's about us supporting you to integrate you into a professional career and into the workforce, into shift work and so forth. We're here to promote professional development of yourself, as well as a lot of personal development that you'll go throughout the year. We help to support you to adapt to shift work and professional responsibilities, which is sometimes just as challenging as looking after the patients. And that leads us into supporting a really positive work-life balance, because nurses are very renowned for getting burnt out, and there's lots of rollouts across the hospital all the time, and you can get burnout very quickly, and even compassion fatigue. So we do realise that it's a difficult year, it's going to be challenging, and we want to support you to best maintain that work-life balance. And we also offer health and wellness programs throughout Austin, and there's lots of supportive services that you can access, and that's for all staff, obviously not graduate specific. So there's lots available to you. In terms of future career options, there's lots of options for you. So obviously we want to retain you and recruit you in the organisation following your graduate year. So we do offer some areas that we don't necessarily offer in the grad program, like ICU. There's various post-grad courses available, as you can see there. There's the option to take a permanent ward position, so you might just decide you want to stay on to a ward maybe that you've done a rotation on and apply directly to them. There are options for nurse pool, nurse bank, that kind of thing. So there's lots available, and most years we retain about 90%, if not more, of our graduate nurses. So, we invest a lot of time and effort into you throughout the year. We don't just want to, sort of get to the end of your 54-week contract and say, yep, see you later. We're done with you now. We want to keep you on, and we really want to sort of help you develop and grow in the organisation. These are just some of the benefits that you can enjoy at Austin Health as a staff member. So we've got, secure subsidised car parking, childcare for those of you that have kids, generous salary packaging options. We've got, I'm not sure that we have the staff clinic anymore actually, that might be a bit of old news. We've got a wonderful health services library that's just opposite this lecture theatre. They're absolutely fantastic. Secure bike storage. We've got a lot of staff discounts with local businesses who like to look after our nurses. I usually go for massages. There's a really good $50 for an hour, so I can definitely recommend that. We're obviously in very close proximity to public transport. We're right opposite a train station near buses, so it's quite easy to access. Like I mentioned earlier, we've got a lot of staff health wellness programs available, employee assistance program, and health insurance benefits. So lots and lots. I'll hand over to Kerry now to talk about applications, which you're all eager to hear about.
So just before I move into this section, and this is often where you may have lots of questions, I just want to reiterate a couple of things that Sonia has mentioned. So you're obviously going to be doing lots of, research and thinking really seriously about your 4 options for when you're applying to Computer Match. So I just really want to reiterate, at Austin Health, the premise of our graduate program is consolidation. So if you really have a great feel or need that you want to go somewhere like theatre or ICU or ED or a highly specialised area, I'd probably have to say that Austin is probably not the program for you. It's not what we promote in our graduate program. We know from experience and we know from research and literature that grad year is a transition year, and we firmly believe that we offer the best options in consolidation in giving you 2 very different 6-month rotations. So just think about that carefully when you're looking at your options for what may suit you, because I think that you really need to be committed to, I guess, what we offer in our program, as well as we would be committed to you if we selected you in our processes. So again, I'm not saying that we don't offer those areas, but a lot of people coming into grad year really hell-bent on, I really need to go here, or I want to go here because of a prior experience, or maybe because it's somewhere that you haven't experienced before. But the team will attest, once you start a job in a graduate year, so many of our graduates go to a first rotation to a ward they've never ever experienced before, and then at the end of that rotation they'll be saying to me, I don't want to leave here and now I want to do a postgrad in this area that before I told you I didn't want to go to. So what I'm saying is be very open-minded. When you're looking for graduate year, you're looking for a program that will best support you in your transition from a student nurse to a registered nurse. It's not about specialising. Specialising you will do throughout your whole nursing career. Okay, so if you think that's what you want, that's what we offer, and so we're probably a really good graduate program for you to apply to. So I just wanted to say that before we get into the application process. Now, as I mentioned earlier, for those of you that are enrolled nurses, you don't need to worry about this computer match part of it. But for the other two programs, obviously you do. Actually, I believe Computer Match would have opened today, wouldn't it? 29th of May, that's right. So you can obviously apply and set up your register there from now on, and then you would then need to apply directly to any of the organisations, and particularly to Austin if you're applying to us online. Our online application won't be available probably till the Monday of the long weekend. That's when we envisage that it will open. And it will remain open until the cut-off date, which I've got the dates on the next slide. So you've got plenty of time to get your application in order. Again, I know with your research, and some of you have already heard all of this, but you just need to specifically supply what you are asked for, nothing more, nothing less, because we receive so many applications, and if we open applications and when we're reading them, we don't have all of the information, they'll go to the side, all right? So again, my next best tip, get your friends, your family, your colleagues to read your applications, to reread them and make sure that you've got everything that you've been asked for. Because every year, and it's not just Austin, it happens everywhere, particularly Austin and Alfred, we both start with A, we get letters saying, Dear Kerry, I'm so excited to apply to Alfred for your program. And then Sue at Alfred gets letters for people applying to Austin. So we know it's a legitimate mistake, but that's a mistake. That's not taking attention to detail, and we would put that to the side. That'd be one of the first things that all of the coordinators would probably, might not be shortlisted for an interview. So just be very, very careful and really meticulous with your application. So we need a one-page cover letter outlining why you want to apply to Austin Health, what you know about the organisation, what you know about the program, why you're attracted to our program, and also what can you offer our community of patients here at Austin Health. A concise CV, no more than 3 pages. Some of you, this won't be necessarily your first career path or your first job, so you may have lots of prior experience. Again, and we appreciate that, and we love to see everything that everyone's done on their CV, but you need to condense it to 3 pages. And in those pages, you need to have clearly marked all of your clinical placements that you've done over your 3 years. Where format, you can do it in dot points, just as long as it's easy for us to read. And then you'll have to supply current contact details of 2 nursing referees, and preferably those that have been with you in the clinical practice. Now, you can provide your clinical educators from your university, but not a lecturer that hasn't worked with you on the floor, because they won't be able to answer our questions when we're ringing for reference checking. So it can be a second year, it doesn't have to be all from third year, because we understand some of you still won't have completed some of your placements, but a second year and or a third year or 2 third years. So it'd be a buddy on the ward, a preceptor, or someone who has been working with you on your clinical placements. And if you, in the first instance when you first apply, you can always leave a note saying that you're going to supply another referee at the time of interview. A lot of people do that because they want to, or they want to update their referees when they come to interview, so that's fine. We don't actually ring your referees prior to interview, but it's certainly something that we need after interview. Your referees need to be contactable via phone and if not email, and they can't be overseas. Okay, so I know, you know, some people go travelling or whatever it may be, but we have to be able to contact your referees. Two of your most recent, yes?
Would you like non-clinical referees as well, or just?
No, we don't need non-clinical. So the question was, do we need non-clinical or personal referees? You can list them on your CV if that's what's written on your CV, but we don't need them, no. Again, they wouldn't be able to answer the nursing type questions that we ask, so that's fine. Two of your most recent clinical appraisals. Now I'm going to try and clarify this as clear as I can because these are the most questions I get asked. It can be second year or third year, but your two most recent. Not mental health unless you're applying for the combined stream. You can supply us with any other clinical appraisals of any areas that you've worked in. We actually preferred your ward ones, so if you've been in ICU or theatre, you can still supply those if they're the only ones you've got, that's not a problem. But if you've been in subacute, if you've been in aged care, that's absolutely fine. They're the patients that you're going to be looking after in grad years, so we do like one acute appraisal, but the other can be from anywhere, community, whatever you've done. Does that make sense? So we need preferably two of your most recent. The reason I say that is we don't want first year or early second year appraisals because again, they're not really indicative of where you're at this time of the year. If you are going on placements or you're on placement during the application processes, again, you might want to supply another appraisal at interview to add to your application, and that's perfectly fine. But for the application process, you've basically got to supply what you have. Yep. And you need to, when you submit the appraisal, if we can't see where it's from, it's just got the pages with the appraisal, then we have to backtrack to your CV. Again, that takes time. You need to clearly indicate where the appraisal's from, what date it was from, and what location you did your clinical placement in. So it's all about making it easy and readable for those of us that have, 800 applications to review. Okay. Now, each appraisal, some universities have short appraisals and some are very long. So I've actually increased the maximum this year. You can submit 10 pages per appraisal. So you'll be able to submit a total of 20 pages, but they'll be in separate documents. You'll see how that works when you log in. So again, with the appraisal, if you have a 30-page appraisal, you just supply us with the summative section of it. And you must have your comments from your buddy nurse or your preceptor included. So that should be more than enough for you to supply with 10 pages each. If you're from La Trobe and you use Pebble Pad, then you still need to download that appraisal from your Pebble Pad. We can't look at your Pebble Pad online, but you don't need to get that certified because it's certified by your university. So you'll just need to get the hard copy off your Pebble Pad of those 10 pages and submit it to us. And for us, you have to bring all of that hard copy to interview anyway. So you may as well, my advice is again, with all your applications, get all your paperwork, get it all together, however many multiple copies you need, take it down the local police station or your pharmacist, get them all signed, and then you're ready to go. If you're fortunate enough to get interviews as well, okay? So again, that might save you a little bit of time with your applications. You need to supply your transcript up to date. So most universities will release your transcript for you up until when you put the application in. So we definitely need your first and second year and the results so far from your third year from your university. So you need to start applying for those if you haven't done so already. You don't have to supply us with the original version of it because I know sometimes there's a cost attached to it, but you can photocopy it and get it signed and upload that. Yes, you had a question?
If you did the diploma, so you did the do you want copies copies of our diploma transcripts?
Yes, it'll come on your transcript from the university anyway.
But I did it a separate university.
Oh, sorry, beg your pardon. Yes, you can supply that if you like. but
That's our first year.
exactly, that's your subject. Yep, that's absolutely fine. So the question was, if you're transitioning from diploma, yes, you can supply your diploma transcript as well. Yeah.
We, at the Trove,
Yep.
we don't actually get our results till very close to the application closing date.
Yep.
So can we mention in the cover letter that we will provide an unofficial transcript or official
Yep.
interview?
Yeah, that's absolutely fine. Yeah, we're pretty attuned. We know that that happens. So, yeah.
And would you require another official transcript for the interview, or would an unofficial certified copy be okay?
Yeah, as long as it's certified, that's fine. Yeah.
Thank you.
Yes. Someone else had a question? Oh, same. Okay, good. Yeah. And what else was I going to say? Oh, yes. And if you're obviously applying for the mental health streams, I've just got the website there. So enrolled nurses, again, different process, not computer match. Our applications should open for that program on the 4th of September, and then we'll shortlist and have a different interview slot for our enrolled nurse program. Just running over the dates again. So we've talked about today, our online application should be open on the 12th of June. If it's not that day, it will be the next day, definitely that week. 21st of July, close dates for your computer match, and we'll be holding our interviews in early August over about 7 to 10 days. And if you are shortlisted for an interview at Austin, you'll just get an automated time to attend the interview. We know most of you will be on placement, but all of your universities and organisations are aware that you're going to be attending graduate program interviews. And so what normally happens is you leave your placement for that duration of time, and then depending on your university, you make that time up at another stage. So I guess basically what I'm saying, when we're interviewing 450 people, you actually can't pick and choose unless there's an absolutely extenuating circumstance for your interview time. So you can obviously alert us if there's an absolute reason why you can't attend, but you do need to negotiate those times if you're on placement with your university. Okay, and that'll be again the same for most, especially the larger programs and organisations. Now, occasionally you may have accepted an interview with another organisation and then, or vice versa, and then we send you one for the same day. Of course, that's an extenuating circumstance. You can't attend 2 interviews at the one time, so we'll be able to change that around. And you can obviously after interview, and some people choose to do this just for whatever reasons, you may get a different feel for different organisations that you may interview with. You may decide to change your preferences around on computer match. Again, my advice regarding that, because I hear various stories over the years of what happens with this, you should go with what you feel is your best option for getting a graduate program. So don't change your preferences based on what someone else is telling you. I've heard of people who took Austin off or put them down the bottom because someone has told them you'll never get into Austin, they have too many applications and you're better off going for another organisation. You know, you hear all sorts of things like this. If you hear stories or things about grad year applications, and I'm not just talking about Austin here, but clarify it with the coordinator or someone from the education team. It's really important because you want to maximise your chances of getting a position, you know, because in actual fact it is, as you know, fairly competitive. So that's what your aim should be when you're listing your 4 organisations. And then, of course, in October, we all learn on the same day who gets matched to where. And at Austin, we would give you a call certainly on that day, if not the next day. And that's when we would clarify all sorts of things with you regarding when you would start the following year, what we need to do to get you onboarded for recruiting and all of that sort of stuff. So you don't need to worry about any of that until you actually know which organisation, hopefully Austin, that you're coming to. Okay. Here we go. I'm not going to go into too much detail here about the computer match process. I'm sure, again, that your education providers have given you a lot of this information, and also at some of the other expos and things that you may have attended. So I really just want to reiterate, do your research and list your 4 best options of where you want to go for a graduate year. If you don't get your first, that's okay. If you don't get your second, that's okay. If you don't get your third, that's okay. If you get your fourth, that's great. If you happen to miss out, then it's not, a disaster. A lot of organisations have positions afterwards, and a large portion of graduates that miss out on graduate programs are successful in gaining employment after the fact. So if you happen to be in that category, don't give up hope. Don't think that you're never going to be a nurse and it's going to prevent you from having a long career in nursing. It won't. It's just a fact of the matter at the moment that there are not enough grad places for the people that apply. But that is going to change very quickly in the next few years with the forecast for nursing shortages. So, again, that's my best advice. But put your four best options. What's going to suit you in your graduate year? We stick very strictly to the rules of computer match. We cannot offer you positions at interviews. If any other organisation does that to you, they're breaching the rules. So you come to interview, we don't say to you at the end of the interview, that was fantastic, we're going to give you a job. That's not how the process works. So just to reiterate, we can't give you feedback on that day, but like anything, I'm sure you may have a feeling of how you may or may not go in the interview. But again, we've got plenty of grads this year that have told us they left our interview feeling that for whatever reason they did really poorly, and they were matched to us because clearly they didn't do poorly. So, we understand that it's a nerve-wracking process. And I'll talk about that in a sec because I want to try and finish up here. So I've already mentioned a lot of this. I've already gone through all of that. Interview tips: confirm your date and time. Be at any interview you attend early. There's nothing you want to do worse than arrive to an interview late. In our interviews, you won't actually be allowed to come in because it's a group interview and the group interview would have already started. Again, there could be extenuating circumstances, but just, make sure that you tick all those boxes. Try and stay calm and be confident. Again, we know it's really nerve-wracking. I think our interview process here at Austin, we try to make it as enjoyable as an interview can be. And we just really want you to present yourself as you are. That's all it really. You can't rehearse for an Austin interview. We don't have medication tests or drug calculations. We don't test the knowledge that you've learned over your 3 or 4 years at university. So we don't ask you specific questions about specific disease processes or anything like that. It's all about you as a nurse and what we're looking for in our nurses at Austin Health. All right, so just bring yourself if you are coming to an Austin Health interview. That's the best thing you can do. And remember, it is a professional interview. And again, we're aware that some of you may be on placement, but, dress accordingly and professionally. We have a group scenario followed by a one-on-one interview panel with 2 of us from the graduate team. And again, in the group scenario, we're just looking for some input from you into the scenario that we give. They're only small groups of 5 in the group setting. And then we do get some one-on-one time with you, as I said, after the group interview. And that's for everybody, so everybody will come back in after the group scenario. And everyone obviously will get notified via email if you're successful to interview, and then if you're not successful in gaining an interview. Some of these things I've already mentioned, but again, some of the myths and things that I hear around the traps. You will not be disadvantaged if you've never been or worked in Austin Health in your undergraduate placements. We have recruit graduates every year from usually 12 or 13 universities right across Victoria. Okay, so for those of you that may never have been at Austin, that's reassuring for you. You know, if you haven't been in big acute hospitals again and you haven't had placements in, you know, the busiest ward at Royal Melbourne or here or whatever, again, you're not disadvantaged because of that. It's more about, you know, what we read in your clinical appraisal, in your approach to your placements. That's what's most important. All graduates are open to any of the clinical placements that you may list as a preference for us. And again, we don't need to know that before interview. We only ask for your preferences after computer match. But if you say want to go to paediatrics, you want to go to emergency, then, you know, sometimes we do ask you for another preference because, you know, you could have 50 or 60 people wanting those places and there's only 12, for instance. So, but if you want to put your hat in the ring for, you know, for areas that are quite popular, then, you know, do so. And as I mentioned earlier, don't take Austin Health off your preferences list because you think, oh, I haven't got a chance of getting into Austin. If you've put your best foot forward and this is where you want to be, and you have a good feel about it after your interview, then again, that would be my advice to you. And obviously details there are for further information for any of the programs that we've talked about, and we might have about 5 minutes left for questions. Yes?
I saw with your I got interviewed in early August.
Yep.
Looking at like their placement like overseas during mid-August.
Yep.
Would I put that in my cover letter saying
Yes.
away?
Yeah, please do. Yep. So, because if you were leaving in mid-August, then and you're shortlisted for interview, then we would put you in one of the earlier slots. Yep.
Just with regards to the 3-page maximum of the CV.
Yep.
Our nursing coordinator for our uni has, if you've been accepted into honours, an early invitation into honours,
Yep.
put that with your CV.
Yep.
Would that be included in the 3 pages?
Yeah, well, that would be fine. That would just be one sentence, really,
so
wouldn't
you
it?
need to provide the
No, that's fine. Yeah, no, that's absolutely fine. Yes.
Please roll back to the slide of the first page of tips.
This one? No.
Previous one.
This one?
Another one.
I'll shoot. Yeah. I should take a photo, that's all right. Yes.
Because this is my second degree and I've had a previous career before this.
Yep.
Because there's so many jobs and a large amount of time that I've worked in it, can I just sort of say between 2001 and 2000, this is what I've done?
Yeah, absolutely.
Is that okay?
Yeah, that's fine. There'll be enough room to do that. We have a lot of applications like that. So you can just summarise your previous work experience. Yep. Yes.
If we're providing referees at the interview,
Yep.
do we write that on our CV or our cover letter?
So your referee should also be on your CV, down the bottom of your CV at the very end. But on our application, there'll be a little link that you have to fill in. It'll say referees. It'll give you space to put 2 in, but if you put 1 in, I believe it'll let you keep going through the application, but you will have to supply, the names.
Note saying that you're going to supply that at the interview.
If you're supplying an extra one, yes, at interview, yep, that's fine, yep.
Would you like us to include our upcoming placements on our CV for our?
Yeah, you can do that if you like. So the question was, should you include what your next placements are in 3rd year on your summary of your placements? You can do that, yep.
Just going back to
Yep.
references.
Yep.
Is the education team that you've had with you on placement, are they okay
Yep.
with a reference as well?
Absolutely, yeah. Just, I guess, again, someone who's seen you in the clinical setting. So it doesn't matter who that person is, as long as if you're an RN, it obviously has to be an RN. But yes, it just that say sometimes we call referees and when we ask them the questions, they might say, oh no, I didn't know that graduate in that capacity.
Yeah.
So yeah, that's why we ask for clinical referees. Yeah. Sorry, I think you are back there. Yep.
If you prefer not to have clinical presence from the beginning of second year, but our last placement of second year was mental health, so in that case, it'll need to be
Oh, okay.
first semester, if that makes sense.
So first semester of second year?
Yeah.
and then this year's ones. Yeah, that's okay. Yeah, we'll be able to see that on your, yeah, that's fine. Who was, sorry, lots of hands here. I don't know who was next. Might just start at the front, sorry.
Just in regards to when you can submit your resume,
Yep.
does it matter when you do it in that time period? Or?
Oh, you mean from the time it starts to when it closes? Good question. We would advise you to submit your applications as early as you can. Everyone's entitled to leave it to the last minute, but we will start offering interviews. We won't, you know, we'll obviously still be reading everyone's applications up to close date, but the sooner you get the application in, the easier it is for us. But if you need to delay it for a certain reason because you're waiting on information, that's also fine as well. Now, some of you will probably have to get your questions answered around the corner on level 4 because we're probably going to have to wind up here. And also you can always email me or call if you have any unanswered questions. Thank you.